Hi, I'm Dr. Mikel, and it's really nice to be here again. And today I'm going to talk to you about our new product, the Curcumin Bio Supreme. And of course, there's a lot of information out there about curcumin. And I wanted to just break down a little bit of that information for you today, maybe tell you why this product is a little different, and just shed a little bit of light on the quality of product. So when people come to see me, they often bring in what they're taking, and I would say at least 60–70% of the time people are taking some kind of turmeric. It's well known out there as an anti-inflammatory or, maybe cardioprotective herb. So people are taking it. There's a lot of information on there, and that's not bad. Hopefully you'll learn a little bit more about quality and dosing and what kind to take. But I also wanted to step back a little bit and tell you about products in general. When naturopaths put you on a protocol for a condition like diabetes or arthritis, for example, we might give you a certain formula of supplements. And one of the common questions people ask is, am I going to have to be on this forever? And that then gets me to something I remember from my early days at Bastyr, where an old guy said, figure out what your ailment is and just resign yourself to the fact that you're going to nurture that thing along the rest of your life. So I kind of like that perspective, in that we're all going to have things, in our life, physical health challenges. And instead of fighting that, sort of being disappointed in that or upset about it, I think it's useful to take the perspective that it's going to motivate you to learn how to be involved in your health and be proactive about your health. And many things that we do for one condition help us for other conditions. So I also tell people that once their condition is somewhat resolved, there is a foundation of supplements that I like to see people continue. And one of those would be a digestive enzyme like our Modern Digest complex, vitamin D, optimal for the immune system and your bones. Fish oil, very anti-inflammatory. It has a lot of cardiovascular protection and brain support. A multivitamin and mineral, especially the minerals are needed because our soil is so depleted. Even with the organic foods, often we don't have the minerals, which activate vitamins, which then activate our ability to get energy and nutrition from our foods. And curcumin. I would say curcumin could be one of those foundational supplements because it is such a powerful antioxidant. It's so for me, it's a cornerstone or a foundational support that you could have in your repertoire almost all the time. It does so many things. I did a little research, trying to prepare this talk, and I thought, where do I start? Because there are papers and research being done on curcumin for just about everything you can imagine. But a big interest in the use of curcumin is for cancer prevention, and it is so powerful in the use for cancer prevention, in that it is there's so many ways in which it protects us. So it does work as an antioxidant, protecting the DNA from damage. And cancer is initiated when the DNA of a cell is damaged so many times that the portion of the DNA that corrects the disarray or the damage in the DNA is damaged itself. So then we have cells that can grow out of control. And so curcumin is a powerful antioxidant to prevent that DNA damage, and therefore the initiation and the growth of cancer. It in itself is able to kill cancer cells or make cancer cells die. And one of the interesting things about cancer cells is they don't know how to die and they don't know how to stop replicating. So the fact that curcumin in itself can cause that apoptosis or cell death is a very powerful thing. We often have random cancer cells in our body all the time. Our immune system is taking care of that, and if we are ingesting a beneficial form of curcumin, an effective form, then we have that ability to sort of clean it up before it becomes a problem. It blocks the inflammatory proteins that are produced when cancer's progressing that induce more cancer cell growth. So it sort of interrupts these proteins, these cytokines that are talking to the cells and trying to get them to change. It interrupts that. It stops cancer cells from replicating, and also then is helping you not to have recurrence of cancer if you've had an episode of cancer in your life. So it works in the stem cells to actually keep the cells healthy, so that you're not putting out damaged cells that will start that process all over again. And then it interrupts, or tries to, it can potentially interrupt the blood vessel um, uh, development that feeds cancer cell growth. So this ability of that antioxidant to stabilize vascular system so it doesn't create new blood flow to the cancer cells is interrupted by this curcumin. So I'm a breast cancer survivor of about 20 years now, and when I had to make that decision to do a mastectomy, my Chinese medicine doctor said, if you are going to lay awake at night and worry about that cancer, you should probably cut it out. And that made sense to me because I'm kind of a worrier. And she also said the healthy protocols that you're doing for prevention and to help stay healthy, you're going to do whether you do that surgery or not because you have another breast. So that was one perspective. And another perspective is that when you get cancer and you treat it allopathically with, chemo or radiation, your body still is in an environment that is similar to the one that was set up for cancer to start with in the first place. So I knew that some of the supports I needed to protect me were going to help change that environment. So my interstitial tissue, my cells, the pH, the degree of inflammation was changed. So I have an internal environment that's less conducive to cancer. So my breast cancer survivor wellness protocol included green tea, some form of DIM and L3-carbinol, which has some effect in helping the liver metabolize estrogen, a methylated folate, like our methylation product, CoQ10, another strong antioxidant, plant food, a lot of vacations, and curcumin. So I've been on all those products to some, degree or another. Sometimes I take breaks, but pretty consistently on those all along. And like I say, I'm 20 years out, and I feel like my vitality and I guess inner life force is probably stronger than it was then. So I really believe in that, and have seen really good results with my patients. So this word antioxidant, we throw it around a lot, vitamin E, vitamin C, CoQ10 in itself an antioxidant. What does that really mean? I try to break it down so you can kind of picture it in your mind, but toxins are or it's, let's see, toxins and inflammation in the body create cells, or our cells, that are not very stable electronically. The electrons and protons, just in that the cells are looking to steal electrons from the cells around them to be more stable, so that that's just the nature of what a toxin is, and that's why it's called a toxin, because when these substances steal electrons from tissue, the tissue that it's by starts breaking down. It gets damaged, it gets holes in it, the inside of the cell can then start deteriorating, in the organelles and then the DNA. So when you have cell damage because of these toxins or inflammation, we see conditions like aging, your skin getting older, lines, wrinkles. The skin doesn't regenerate and repair as well because the oxidizing agents, the toxins, even the oxygen, is kind of damaging the cells a little bit all the time. However, if you have a lot of antioxidants, the antioxidants give up the electron and it spares your tissue. Another scenario where we see this is fatty liver disease. So let's say you are exposed, you're a painter or you work in a hair salon and you're around a lot of chemicals, or you work under the airport like I do, you're around a lot of chemicals. When those chemicals go to the liver and the liver needs to break those down, if the liver's overwhelmed or under functioning, those toxins then start damaging, taking electrons from liver cells, and you start seeing some liver damage. In fact, when we do blood work and we see liver enzymes elevated in the blood work, that's a sign that the liver is overwhelmed or under functioning because the toxins are um, greater than what the liver can clear out, and it's starting to damage the tissue that it's around. Another area we see a lot of damage from toxins and inflammation is the brain. So again, we have a blood-brain barrier, but many of these toxins are able to cross the blood-brain barrier, and inflammation gets set up in the brain. And when we have cell damage in the brain, we can get problems like memory loss, mood disorders like depression, anxiety, and then a whole host of learning problems, ADD, autism. So brain damage and brain protection is crucial. Again, we need those antioxidants like a good form of curcumin so we can offer up those electrons and spare the tissue that those toxins get close to. Another example is glycation. So when you have high blood sugar, the sugar in the blood is actually like a toxin. It's damaging the tissue that it's around, and that can happen to the capillaries and nerves. That's the end result of type 2 diabetes. And so, you know, it just goes on. There's a lot of examples of that, but I hope you understand a little bit more about how antioxidants are offering up protection to spare you your tissue when it's exposed to inflammation or toxins. Let's see. Cardiovascular disease, I also wanted to talk about that. The initiation of plaque on the artery is because there's inflammation on the arterial lining. When the toxins are flowing through the bloodstream and those toxins start grabbing electrons on the arterial lining of the blood vessel, then inflammation gets initiated, some cell damage. The body wants to lay cholesterol on that artery to repair it, but if you have a rancid, unhealthy cholesterol, then you can develop this formation of plaque. So if you have a curcumin-like substance, a good antioxidant, it can offer up those electrons, spare that damage to the arterial lining, and then you're not at as much risk for that cardiovascular disease. So there's a lot of mechanisms, many mechanisms, but this product is so, or this plant is so unique in that it offers protection in all these areas. A lot of antioxidants aren't that broad, that general, and that beneficial. They're maybe good for the skin or for your heart, but they don't seem to run this broad range of benefit in the body. So what is curcumin? It actually comes from turmeric, which is a plant that belongs to the ginger family. It's grown in India and Southeast Asia. And we all know turmeric, that yellow spice that's often in curries. But curcumin is a biochemical constituent of the turmeric. And it's a very small, like less than 3% of the turmeric as a spice or as a plant. So the phytochemical, the plant chemical, the curcuminoids, have to be extracted, or your body uses that part of the plant to have this antioxidant protection. And when you get a good product, it will be standardized to contain 95% of these curcuminoids. So when you just use turmeric for cooking, there is some advantage. It's beneficial. Some people make it as a paste or will take it as a tea. That's beneficial. A lot of people come in with their supplement and it's a turmeric, but it's not this standardized extract. And it's not as powerful. It's not going to be very bioavailable, and it's not really strong enough to have this broad range of antioxidant protection. So it's important to understand that. A lot of people don't know that, and if that's something you learned from this talk, that will be to your advantage, because why waste your money on a product that is really not going to give you the desired results? Another thing about these curcuminoids is that they're not very easily able to be digested and carried across the intestinal lining. And so you need a form, you need it produced in a way that it's more bioavailable. And the product that we are uh, promoting these days, or labeling, is a form that contains not only one but three of these bioactive curcuminoids, the ones that have been studied with the most antioxidant protection. And they're patented in a way so that they're very bioavailable using a turmeric oil. And it's patented to optimize that digestibility and that assimilate, so you can assimilate those actual curcuminoids and get the most out of the product. It's a proprietary process that uses all natural ingredients, including that turmeric oil, sunflower lecithin, vitamin E, and it does not use any harmful chemicals in the extraction process. Also, all of the products that we use are GMO-free, which is really hard to find and often not even labeled. So if you start wanting to get to even a better and better quality of product, start looking for those kinds of things. So how do I use it in practice? Well, recently I had a sty, or chalazion, on my eye, and I had a really bad eye infection. I had to go on antibiotics. My whole eye was inflamed, and that was what I had on the shelf. I had the Curcumin, and I had our Move and Free Inflamma Ease product, both really good for inflammation. So I started pounding it. I was doing three times a day of the Move Free, and I was doing 3 times a day with the curcumin, and I think it really helped. The eye resolved pretty quickly, the antibiotic was effective, but what I noticed is that I have one joint where I have a little bone broken that is kind of my indicator for inflammation, and I didn't really realize it, but when my eye recovered and I stopped the product, my finger started hurting again, and I thought, shoot, my finger hadn't been sore for at least almost 2 weeks. So I thought, that's interesting. So I started the product again. I kind of cut down the dose to like 2 of the Move Free and 1 of the curcumin twice a day. So 2 and 1 twice a day. And that pain resolved. My little, achy hip was better. And so I kind of found my maybe optimal therapeutic dose to continue, maybe on a maintenance basis, or to, at least for a while, to get that inflammation that tended to set up in my body under control. So I think that's really how Dr. Koch and I find products that we like, and then come up with recommendations for dosage, not only what works for us, but what works for our patients. There are so many products out there with the curcuminoids and the curcumin and turmeric, and you can spend your money, or you can, maybe be directed to try a product that's going to be more effective in the beginning. And, there's really not much regulation on quality of herbs. I think professional line products are always the way to go when you use herbs. I don't always say that about minerals, but herbs especially, because how they harvest the plant, if they extract the standardized extract, the quality of how they process it, and the dosing is really important if you're going to get the effect that they tout in the literature. So I hope you learned something from the talk. It's nice of you to join in looking at this one today. We just finished a talk at Marlene's Market in Federal Way on anxiety and depression, and that went really well. I hope you look at that if you're interested. Our commitment with Synergy Gold really is to empower people to make lifestyle changes and find the best products, the best self-care for yourself. The world needs a lot of help right now, and a patient reminded me, if I can help you be your optimal self, you're going to go out and make a difference in the world. You're going to live your passion and your purpose. So that really is our intention, and I hope again that you join us for more talks, and it was a pleasure to be with you today. Thank you.